Come in.
Hello, today I'm going to be your student nurse. My name is Dinesh Baños, and I'm going to be performing a head-to-toe assessment on you. What this requires is me having to touch you and me having to ask you a few questions. Is that okay?
Yes.
Okay, great. Before I begin, I'm going to ask you what is your preferred language?
English.
Okay. And what, I'm sorry, do you need to use the restroom before we continue?
No, I'm okay.
No? Okay, great. And before I touch my patient, I'm going to go ahead and be performing hand hygiene. So this requires me washing my hands for 15 to 20 seconds, and then I will be applying gloves. As of right now, I don't have any, so I cannot do that at this moment. Okay, so can I have your wrist, please? Can you tell me your name and your first and last name?
Caitlin Estrada,
And your date of birth?
August 29, 1995.
Okay, great. Can you tell me where you are?
I'm at a hospital.
Okay, and can you tell me who the president is?
Donald Trump.
Okay, great. So my patient is awake, alert, and oriented times 4. As I see my patient, she's sitting here straight. She's not slouching. She doesn't seem to be in any signs of distress. As I inspect her skin, what's visible to my eye, I don't see that she has any discoloration. She doesn't have any signs of dryness. She doesn't appear to have any acne. She doesn't. She's addressed according. I will now be providing privacy for my patient as I take her vital signs and ask her a few more questions. Do you have any allergies I should know of?
No.
And are you in any pain at this moment?
No, I'm not.
Okay. So right now I'm going to be taking her vital signs. As I said, I'm going to take her blood pressure. I'm going to take her pulse, and I'm going to count for respirations. I'm going to be using my stethoscope and my blood pressure cuff. What's usually your baseline for your vital signs?
My baseline is usually 117 over 75.
Okay. Just give me 1 second. Okay, and now your arm just like that. Can you move your hair for me, please?
Yes.
Thank you. Okay, your blood pressure was 130 over 80. Can I have your wrist, please? Thank you. Okay, your pulse was 90 and your respirations was 18.
Thank you.
Okay, so now I'm going to be continuing on with my assessment. Since I've already taken my patient's vital signs, I know, as she told me, her baseline was 117 over 75. Her blood pressure right now was 130 over 80. Normal, not a problem. And now I'm going to be starting her assessment from her head all the way to her toes as I touch her, which I hope that's okay with you,
Yes.
and ask you questions along the way, okay? And at any moment you feel pain, you let me know.
Okay.
Now we'll be starting my head-to-toe assessment on my patient. Before I touch my patient, I'm going to be putting on my gloves, so I'm pretending right now because I don't have any at the moment. Okay, so I'm going to stand behind my patient. Right now I'm going to be inspecting her scalp and her head for what I can see, and inspecting her hair. For what I can see, her hair is not dry, it's not brittle. There's no signs of hair loss. There doesn't seem to be any bumps, any lumps, any drainage, any open wounds, lesions. There doesn't seem to be any dandruff, and her hair seems healthy, all one color, and that's what I see right now. And I'm gonna now, after inspecting, I'm gonna go ahead and I'm gonna palpate your scalp. So this requires for me to touch you. Is that okay?
Yes.
Okay. And if you feel any pain, please let me know.
Mm-hmm.
So as I said before, I would have my gloves on, as I don't right now, but my hands are clean and washed. So do you have any pain when I
No.
touch you? No. Again, I don't feel any bumps, any lumps, any other abnormalities that I can feel. As I said before, as I look at her hair, healthy, all one color, does not seem broken or brittle, and no signs of alopecia as well. And so now I'm gonna continue on. So since I'm already behind the patient, I like to go ahead and already test cranial nerve number 8, which is known as vestibular cochlear. This tests the patient's hearing. So the way I'm going to be doing this is I'm going to ask my patient to go ahead and cover one ear at a time, and then she's going to tell me what she hears. And if she tells me correctly, then I know that her cranial nerve number 8, vestibular cochlear, is intact. Okay, Kaylin, so can you go ahead and cover the left ear for me? And now, oh, I didn't say when we I don't know if I said that when we whisper something in her ear, but just in case if I didn't, I whisper in her ear with the ear that's open. So
7B2.
okay, great. Can you cover the other ear for me, please?
954.
Okay, great. So my patient's cranial nerve 8, vestibular cochlear, is intact. So now I'm going to go ahead and be inspecting my patient's ears, and then I will be palpating her ears. So can you pull your hair back for me, please, if you don't mind? Thank you. Okay, so as I inspect my patient's ears, I don't see any bumps, any lumps, any sign of drainage, any open wounds or lesions in this ear. I'm going to go ahead and I'm going to be pulling the ear up and back, since she's an adult, to go ahead and look inside her tympanic membrane, and I should be looking for the tympanic membrane should be gray and pearly. Okay, perfect, gray and pearly. Now I'm going to be checking the other one. Sorry, I'm just going to move this here. Up and back, tympanic membrane, green and pearly. And now I'm going to go ahead. Oh, I noticed that you have pierced ears. Do you have any other piercings I should know of?
No.
No? And have these ever been infected before?
No.
Okay, great. So now I'm just going to be palpating your ears, and you let me know if you feel any pain.
No.
No?
No pain.
No pain? Okay, awesome. Great. So now that I've already inspected, palpated, and tested my patient's cranial nerve 8, inspected and palpated her ears, I'm going to go ahead and move to the front of my patient. I'm going to be starting from her head. So as I see her face, I don't see any discoloration, no acne, no signs of dryness. Her lips are not dry. They're pink and moist. Her eyes as well, there's no signs of drainage. Her eyes are symmetrical. Her nose is midline. And I'm going to go ahead and move on. So I'm going to be starting with cranial nerve number 1, which is known as olfactory. And the way that I'm going to be testing this cranial nerve is by having my patient close her eyes, and she's going to tell me what she smells. But before I go ahead and do that, I'm going to go ahead and be inspecting her nose a little closer. Okay, so as I see your nose, it's midline. I'm going to go ahead and have you look up for me so I can look at your septum. The septum is not deviated, and nostrils are clear, no signs of drainage, no lesions, no bumps or bruising for what I can see, or any other abnormalities visible to sight. I'm going to go ahead and I'm going to be palpating her sinuses, and you let me know if you feel any pain, okay?
No.
No? No pain?
Mm-mm.
Okay, great. So now I'm going to go ahead, like I said before, and retesting cranial nerve number 1, which is known as olfactory. Kaylin, can you go ahead and, well, before I ask you, okay, can you go ahead and close your eyes for me, please? And you let me know what you smell, okay?
Mm-hmm. Alcohol?
Okay, great. My patient's cranial nerve number 1, olfactory, is intact. The patient was able to state what I put in front of her nose without looking, which was rubbing alcohol. Okay, sorry about that. Okay, so now I'm going to move on to cranial nerve number 2, which is known as optic. The way I will be testing this cranial nerve is by having my patient close one eye at a time. I would have her stand 20 feet away from a Snellen chart. So this will be testing her visual acuity. And then afterwards, I would be testing for Perla. I would be seeing if her pupils are equal, round, and reactive to light and accommodation. So I'll be doing that shortly. But before I go ahead and do that, I'm going to be inspecting her eyes a little closer than what I did before. As I see, the sclera is white. She doesn't have any drainage. Her eyes are symmetrical to one another. And I'm going to go ahead and I'm going to ask my patient to look up as I pull down your eyelids. If that's okay with you, I'm going to be looking in her conjunctiva.
Yes.
Okay? So conjunctiva is pink and moist. And again, no other signs of abnormalities. And visible to sight, as what I can see right now. And now I'm going to be doing both tests, as I said. So can you go ahead and close your left eye for me? Oh, by the way, do you wear any glasses?
No.
No? Okay, great. Okay, so can you close your left eye for me, please? Okay, and can you tell me what you see?
Z, B, G, A.
Okay, great. And can you close the other eye for me, please? The second line?
D, F, G, B.
Okay, great. So my patient's vision is 20/20. Okay, now I'm going to be testing for Perla, as I said before. So this would require for me to turn off the lights. Should I close the curtain?
If you want. You
Yeah.
can just state it.
Okay, well, because we are not in a hospital setting and we are at home, if I was in a hospital room, I'm going to have to turn off the lights, and I would be testing. I would be testing, as I said, to see if the pupils are equal, round, and reactive to light and accommodation. So the reason why I would turn off the light is to look inside my patient's eyes to see if her pupils constrict or not. But I can still go ahead and do that by standing in front of her. So I'm just going to be doing that just very quickly, and then I'm going to be testing for accommodation with my pen light. Okay, great. So my patient's pupils constricted, and now I will be testing for accommodation. Okay, so go ahead and look at my pen light, and just continue to look at it. Okay, great. So my patient's pupils were equal, round, and reactive to light and accommodation. Okay, so now we're going to move on to cranial nerves 3, 4, and 6, which are known as ocular motor, trochlear, and abducens. These three cranial nerves you test together because you are testing the 6 fields of gaze, so we are testing your eye movements. And the way I'm going to be performing this is by using my pen light again. I'm going to have my patient go ahead and just look at my pen light. She won't move her head, and she'll just be following my pen light as I go. Okay? As I said, look at my pen light, and don't move your head, okay? Okay, great. So my patient's 6 fields of gaze is intact. The cranial nerves 3, 4, and 6, as I mentioned, were tested and are intact. Okay, now I'm going to be moving on to cranial nerve number 5, which is known as trigeminal. So the way I'm going to be testing this cranial nerve is by having my patient close her eyes. So she's going to tell me if she feels a sharp sensation or a dull sensation. This test for facial sensation. And then I would have her bite down. I would be feeling for her temporomandibular joint, her TMJ. Have her bite down for mastication. Okay, so we're going to be performing those tests right now. Okay, can you go ahead and close your eyes for me? Thank you. Okay, so let me know in what area of the face you feel the sharp and dullness, and tell me if you feel sharp or dull.
Okay.
Okay?
Forehead sharp. Left cheek dull.